There's a lot of valuable information out there to help you navigate the complex world of retirement planning. And today we want to dive into the ideas with respect to retirement planning in a recession as it pertains to your health care. Now that's what we're going to be discussing today, that essential topic, retiree health insurance after the age of 65. So we'll cover everything from understanding Medicare, how the private insurance options operate, and how to budget for your own personal health insurance during retirement, and especially doing so in a recession. As you approach retirement, it is crucial to have a comprehensive understanding of your health insurance options. And with the introduction of Medicare now, you're going to find that navigating all the healthcare landscapes can be somewhat complex. But we're here to simplify it for you. Now, today, what we're going to be going through is all the different stages of the health insurance coverage options that you have in retirement. Now, we're going to start with the pre-65 years, all the way through the transition from your employer insurance to Medicare, and then we want to be understanding the private insurances alongside Medicare. Now, we also will be estimating the costs for your family, and then lastly, I want to give you a step-by-step process for how to sign up for Medicare and the private insurances. Before we dive into the specifics, let's establish a clear understanding of the health insurance landscape prior to age 65. You see, many individuals receive health insurance through their employers, but what about you? What about your retirement? That's what we want to be here to find out, is all the different details for you, the options you have available, and where do we go from here? Part number 1, understanding health insurance options. All right, let's dive in. Now, typically, employer-sponsored health insurance plans provide coverage for you as the employee and your dependents until you retire. So this could be at age 65, it could be prior to that, or it could actually be later than that as well. But retirement is what marks the end of the coverage for your work coverage. Now, it's also important to be prepared that there's a lot of changes that happen here, and we need to explore those options. So one of the solutions that you can be working on here is continuing your existing coverage through your employer with respect to COBRA. Now, this allows you to maintain your existing health insurance plan for a limited period of retirement. Now, here's the caveat though, that COBRA can be quite expensive, and you'll be responsible for both your portion of the insurance as well as the employer's portion of the premiums as well. Not to be outdone though, there are other options. One of those options for you is to explore the individual health insurance plans that are out there through the state and through the marketplace. Well, these plans are comprehensive, so they can be all-encompassing, but the premiums vary widely based upon your age, location, and the individual circumstances that you're in. So it's going to be good for you to review this very carefully so that you understand all the different types of plans and you can make a budget for your needs as well. There's one other piece here as well that we can be talking about. Some retirees may qualify for health insurance through their spouse's plan, because if your spouse is still working, you may qualify to go onto their employer-sponsored plan. Now, if this option is available to you, I would definitely suggest it's worth considering, because it can provide that comprehensive coverage and it could be at a lower cost as well. So it's important to obviously take a look at all the health insurance coverage options that you have prior to age 65 to bridge that gap between now and when you are Medicare age. And Medicare is the system that the government has set up, the program that provides coverage to all individuals that have obtained the age of 65 and older. Well, there's also ones for certain disabilities as well, so you may be eligible prior to the age of 65. And understanding how to make this smooth transition from where you're at today to Medicare and from your employer-sponsored plan to the Medicare plans, having it be seamless is going to be a very interesting experience in retirement. And that's what we want to spend the rest of our time talking about now. So the details of how we make that transition happen and what that means for you, and especially for your insurance coverages in retirement, and one that could be happening during a recession. Hey, it's Nathan Krampe, and I create these videos because you are likely very ambitious when it comes to your overall wealth plan. Now, in a recession, we need to understand all the different aspects of your wealth plan, and one of those areas that's very important is to understand your health insurance options, not only after the age 65, but prior to the age of 65 as well. That's what we're discussing today, and as you have questions or comments, feel free to list them below in the comment section, as well as to like this video so others can find it, and don't forget to subscribe to our channel so that you can be kept up to date on new videos that are coming out with respect to wealth management. Part number 2, health insurance prior to age 65. Before we proceed, I wanted to just let you know that we have talked a little bit about this, but I really want to hone in on the details behind this because it's going to be very important if you have retired prior to the age 65 in order to make sure that you have the coverage you need. So that's why I want to spend a little more time here. Now, you may be like other individuals that received health insurance coverage through your employers. And this is what we've been talking about already, that this is your employer-sponsored plans that you've had, the coverage, and it really does actually include a lot of different elements most of the time. So medical, dental, vision, all of these benefits that you may have had from your employer, and it was for you and your dependents. Now, again, once you retire, you need to explore some alternative options because most likely your employer plans go away in retirement. Now, one option that you have available is to continue this, and like we talked about before, that this is through COBRA, and COBRA allows you to maintain your coverage. So this is, again, we've talked about a lot of this stuff, but I really want to make sure that you know the different options you have available. And yes, COBRA is one of them, and it goes for a period of time, but it can help you to bridge the gap between where you're at today and when you become eligible for Medicare starting at age 65. Now, COBRA can be quite expensive, so that is something to know here. And COBRA is basically something that now you're going to be responsible for your own portion of the premiums as well as your employer's part of the premiums as well, their portion. So that's something to know here and why it can become so expensive, because your employer previously had covered that on your behalf so that you had a lesser amount that you may have needed to pay out of pocket. And that could be a significant amount of money now on a monthly basis as just going to premiums compared to what you were paying. So it's essential to take this into consideration and to carefully evaluate all the different options you have available for you for COBRA coverage. And if it's going to be financially viable for you, I would definitely suggest this is going to be an option that you should at least look into more and consider if it's going to be right for your retirement. Another option that you have available then is coverage through an individual health insurance plan. Now, this is generally through the marketplace, and these plans can be comprehensive. So the coverage can be wide-ranging, and it can be just for yourself, or it can also be for your family as well. So that is something to take note here, that if you don't have the employer-sponsored insurance plan anymore, we can go to the marketplace. And the premiums are going to vary widely, so again, it's going to be based upon age, location that you live in, your income that you have, all of that's going to be taken into account. And when you explore all of these different options, these health insurance plans, you're going to want to know your needs. So all the different things that you have cropping up with your health and how that relates to the different plans that are out there so that you can help budget correctly. And you can review the options that are available and compare the costs and the benefits and all the different plans that are out there. That's what's nice about the marketplace, so that it helps you to make these choices and to help you to choose the best one and to check to see if you qualify for subsidies like tax credits as well. So all of that can be helping to reduce your overall premiums that you pay for your insurance. Now, you may actually have the option to join your spouse's retirement, the spouse employer sponsored plan as well. So in retirement, I'm talking about there, maybe your spouse is not retired yet and you have the ability to go onto their plan. So if they are employed and they can allow you to come on, that may be great to have coverage through their plan. Well, this can be a very cost-effective solution, and it's one that obviously be sure to review, because the plan coverage, the providers that they have, all the associated costs that come with having this type of plan, if it meets your healthcare needs, then fantastic, and that may be a great option. Now, lastly, it's going to be important to remember that the health insurance covered prior to 65 years old is a crucial period for you in preparing for the transition from now until Medicare. Now, as you come closer to the age 65, you're going to need to start familiarizing yourself with Medicare and understanding the enrollment process, and to make a smooth transition between now and Medicare, that period of time. So that's what we want to be talking about and diving into now, all those different details of how to do that transition well. Part number 3, making the transition from employer insurance to Medicare. Medicare is the federal insurance program. Now, I know you know this, that is by the federal government, but it's for individuals that are 65 and older. But there's also ones that pertain to certain individuals with disabilities. Now, it provides comprehensive coverage for hospital care, medical services, and prescription drugs. Understanding how to make a smooth transition from your employer-sponsored insurance to Medicare is going to be crucial for a seamless healthcare experience in retirement, especially if it's a retirement that's starting in a recession. Well, the first step is going through the process and understanding the eligibility requirements for Medicare. Now, in most cases, you become eligible for Medicare at age 65. However, if you are disabled or have certain health conditions, you may actually qualify for Medicare before turning 65. So it's important to familiarize yourself with the eligibility criteria to ensure you enroll at the right time. Well, the next step is then knowing when to enroll in Medicare. Now, you have the initial enrollment period. This is called the IEP, and it's a 7-month window that begins 3 months before your 65th birthday and includes your birthday month and then extends 3 months after. Now, this is during this enrollment period that you can enroll into Medicare and avoid any penalties or potential gaps in coverage. So, you're already eligible to receive it if you are receiving Social Security benefits. You're automatically enrolled into Medicare Part A and B. However, if you're not receiving Social Security benefits, you'll need to be proactive in enrolling into Medicare. Now, you can do this by visiting the official Medicare's website or by contacting the Social Security Administration. Also, it's important to note that Medicare has different parts and coverages. Now, they all cover different aspects of healthcare. Part A, it provides hospital insurance in the typical premium-free way for those of you who have paid Medicare taxes. So these are the FICA taxes that are coming out of your paychecks. And if we have 40 quarters, now we can put in and have this all paid for. Part B covers medical services and requires a monthly premium. Now, you have the option to decline Part B, and if you have alternative insurance coverage, that may actually be wise. But when transitioning from an employer insurance to Medicare, you'll need to consider if you want to keep other forms of insurance and their coverage along with Medicare. And in some cases, your employer may require you to transition to Medicare from your primary insurance and provide supplemental coverage to fill those gaps. So it's crucial for you to understand the employer's policies if you have health insurance from your employer that's going to go into retirement. Now, again, what this is going to do is help you to make informed decisions based upon your healthcare needs and your budget. If you decide to keep with a retirement plan by your employer for insurance coverage, well, that may be a health insurance from your employer that's a retirement in nature, and it's going to be essential to notify Medicare about your existing coverage. Now, this will ensure that Medicare coordinates with your employer and the insurances that they provide so that you don't have any potential confusion or overlapping coverage. Now, another option to explore during this transition into Medicare is the Medicare Advantage plans. And this is also known as Medicare Part C. And this tends to be something that is offered by private insurance companies and provides an alternative way to receive your medical and Medicare benefits. Now, Medicare Advantage plans often include additional benefits such as prescription drug coverage, dental, vision, and hearing services. So it's worth comparing the different plans to see if they align with your healthcare needs. Again, as you make this transition to Medicare, it's going to be crucial to review your needs and the budget to make sure that you know how much is going to come from an out-of-pocket cost. Medicare has deductibles, co-payments, co-insurance, and you'll be responsible for it. Now, it's going to be advisable for you to explore some supplemental insurance options, such as Medigap policies as well. And this is going to help to cut those costs down and to keep them low with respect to your comprehensive coverage. Part number 4, understanding private insurance to go with Medicare. We discussed the process of transitioning from employer insurance to Medicare. Now, in part 4 here, we'll explore private insurance options that you can complement your Medicare coverage with. Alright, well, while Medicare provides a comprehensive coverage, there are still out-of-pocket costs that you're going to need to manage. That's where private insurance comes in. Now, there are 2 types of private insurance that work alongside Medicare. There's the Medicare supplemental insurance, and that's more kind of formally called the Medigap policies. Then there's the Advantage plans that we've been talking about. So let's take a step back. Let's start with those Medigap policies. There's private insurance plans that help cover the gaps that the original Medicare provides. So those are the gaps, the donut holes, all of those types of things. And there's deductibles, co-insurance, co-payments that start after a certain period, and then we have a point in time really that you may not have all the coverage that you may need. And that's where the Medigap policies become a real necessity. Now, they're standardized with different letters, A, B, C, D, all the way up to N. And you can indicate the coverage that you want and that you want them to provide. So it's important to note that Medigap policies only work with Medicare and not with the Medicare Advantage plans. Now, when selecting a Medigap policy, it's really essential to carefully compare all the different coverages. And we've talked about this a lot because comparing the coverages is really going to come back down to what your needs are. And the benefits of each plan are standardized. So the premiums can vary between the insurance companies. And additionally, not all plans may be available in every state. So this again is why you want to go back and make sure that you're going to get the correct coverage. This is where you have to review your healthcare needs. And it's sounding like a daunting task. I completely understand because a lot of times it can be. Determining which plan's right for you and what's going to be the best fit now and going forward. Well, the other plan that you can go into is a Medicare Advantage, Part C plans. Now, these plans are offered through private insurance companies as well, and they're approved by Medicare. Now, Medicare Advantage plans provides all the coverage of the original Medicare, so Parts A and B, and then often includes the additional benefits like prescription drugs, dental, vision, hearing, and all the different services that go with it. So they can be much more encompassing and comprehensive. And with these Advantage plans, you typically receive healthcare services through a network of providers. And it's important to review your plan's network to ensure that your preferred doctors and hospitals are going to be included here, because you can make changes to the Advantage plans to be ones that are going to include your providers. Now, also, there's different cost sharing agreements as well. So again, going back to the co-pays, the co-insurance, anything like that, they can vary between the different plans and the services that you receive. When considering an Advantage plan, take time to compare the different options that you have in your area and look for plans that align with your healthcare needs and budgets. So pay attention to the factors: premiums, your deductibles, your co-payments, and then your covered medications and prescription drugs. All that is going to be important to you. Now, I want to give you one little piece of information here as well, that what you have today doesn't always have to be what is going to be the same going forward. We can make changes, and we can do so on a yearly basis. But understanding where those Medigap and the Medicare Advantage plans fit in is going to be really part of it, to understand how that works with respect to your Medicare and what you're going to need for overall payment in your retirement. In addition to Medigap and Medicare Advantage plans, there's other private insurances to consider as well. So some retirees may have access to retiree health benefits that are provided by former employers. Now, these plans also supplement Medicare and can provide additional coverage of cost-sharing assistance. So that's also something to be looking for. Another private insurance option is long-term care insurance. And long-term care insurance actually helps cover the costs associated with assisted living, nursing home care, in-home care, and all those different services. And Medicare really provides a very, very limited coverage for this area. So a long-term care insurance can actually be more comprehensive coverage for what you need and help protect your retirement savings. So you see there's a lot here, and as you explore the insurance options, it's going to be crucial to review your needs, budget, and coverage, and to make sure that it's going to be fitting right into your personal retirement plan. Part number 5, understanding how much healthcare will cost in retirement. Estimating your healthcare expenses during retirement is going to be sometimes a daunting task, especially for effective budgeting and ensuring that you have enough resources and money to cover all of your medical needs should something crop up. Now, there are several factors to consider when determining your retirement healthcare costs. First, take a look at all the different premiums that are associated with Medicare. Now, again, Medicare Part A is typically free based upon your work history, and it's going to be for individuals who have paid into the Medicare tax. Now, Part B is something that you're going to need as well as Part D for your prescription drug coverage. Now, those are going to be monthly premiums, and specific amounts can really vary, so it's going to be important to stay updated on your current premium rates. Second, consider the out-of-pocket costs that are associated with Medicare, including your deductibles, insurance, and co-payments for various services. Now, these costs can vary depending on the specific Medicare plans and that you want to be choosing. So it's going to be essential to review your details and how those coverages happen, and understanding the expenses that may affect your overall budget. Third, factor in the cost of the supplemental insurance, such as your Medigap or your Medicare Advantage plans. Again, these are private insurance options, but they do have premiums there as well. So when you pool all this together, it's going to be based upon the level of coverage that you select. And important to carefully review that coverage, because there's going to be different costs that are associated with it, and different policies, and how they fit into your overall healthcare budget. And then we have the prescription drug coverage as well. And Medicare Part D, my apologies, provides coverage for prescription medications, but it has its own costs, and including premiums and deductibles and co-payments. Now, it is advisable to review the Part D plans and how much they cover and all the medications that you're going to be requiring. So there's going to be a little bit of work here. Now, another crucial factor to consider is the potential need for long-term care like we just talked about. So all the different details of nursing home care or in-house care generally is not picked up by Medicare. Now, it's important that you take a look at all the healthcare costs, the specific services that you're going to be requiring, and to estimate the monthly benefits and the monthly expenses accurately. Now, there's going to be a lot of online tools. There's retirement planning calculators, or you can be in contact with us. We would love to sit down with you and start talking through some of these details on how to plan for your overall retirement. Now, what we go through is not only just the health insurance options, but the planning that goes behind all the different details of your retirement. So where you're at today, where you want to go in the future, and then any gaps that exist in your plan, especially when it comes to if we're going to need to be paying out additional money for health insurance. All right, now that we have some at least budgeting behind your healthcare expenses, there's going to be some other things that we can be talking about as well. Now, we can be using retirement savings to specifically pay for some of this, but we're going to also need to be taking into account inflation and increases in medical costs. You see, it's not getting any cheaper, and more so we've seen recently that it's really started to balloon with the overall premiums and prices for healthcare. So we want to make sure that that comes back into your overall retirement plan. And so we explore a lot of different aspects to this, of ways that we can be saving a little bit of money. Do you have an old HSA account that you've been saving into that you can be using for some of these premiums? That may be a good option. Maybe there's other ways that you've saved for some medical expenses, or maybe you even had some from your employer that put into a medical type of plan that you could be using for not only premiums, but also for paying out-of-pocket expenses. So if you're still employed, obviously that's one thing. But because of the fact that you're retired, we're going to need to be going through all of these different options that you have out there to make sure that we can offset these costs wherever they may be. Now, lastly, you can be stayed informed by all of this and by just keeping up to date on some of the changes that are going on with Medicare. Now, that's a daunting task in and of itself. That's why I would suggest working with someone that can help to really go through all the different options that you have available and to keep you updated basically on an ongoing basis. That way you don't have to keep watching CNN every single day to see if there's going to be any changes for Medicare. Lastly, part number 6, I want to give you a step-by-step plan to sign up for Medicare and the private insurances. We have discussed a lot of different things when it comes to just estimating budgets with respect to your health insurance and care and costs. We've also discussed how to do this and what the different parts are. Now we want to go a step-by-step guide on how you can be doing this and sign up for Medicare, as well as the private insurances. Now, I want to step back here and say that there are many individuals that can help you in this process, so you are not alone. But I do want to give you the steps needed in case you want to tackle this yourself. Step 1, determine your eligibility for Medicare. Most individuals become eligible for Medicare at age 65, but there are some exceptions with respect to disabilities or certain health conditions, so review the eligibility criteria to ensure you enroll in the appropriate time. Step number 2, understand the different parts of Medicare. Medicare has several parts. Part A is the hospital insurance. Part B is the medical insurance. Part C is the Medicare Advantage plans, and Part D is your prescription drug coverage. Now, familiarize yourself with these coverages and costs that can be associated with them. Each part of that will need to be basically assessed differently so you can determine which ones you're going to need and what is going to be most suited for you. Step number 3, decide if you want to enroll in Medicare or Medicare with a Medicare Advantage plan. Medicare in itself consists of Part A and B and offers some flexibility in choosing your healthcare providers. Now, Medicare Advantage plans, on the other hand, provide really an all-in-one coverage through private insurance companies. And it's an access to these healthcare needs that you're going to want to do and make sure that you have the preferences that you need to make an informed choice. Step number 4, enroll in Medicare. If you are receiving Social Security benefits, you automatically are enrolled into Medicare Part A and B. However, if you're not receiving benefits, you need to enroll proactively. Now, this is where you can visit the Medicare's website, or you can even contact the Social Security Administration to compare the policies and start your enrollment process. Step number 5, consider additional coverage with Medigap policies. Now, if you choose the original Medicare, you want to supplement that with a Medigap policy, most likely. Now, you can compare the different Medigap policies available in your area and consider the cost of the coverage and what your needs are going to be. Now, you can enroll into these policies within the 6 months of turning 65 to ensure that you have guaranteed acceptance. Step number 6, review Medicare Part D coverage for prescription drugs. If you require prescription medication, consider enrolling in Medicare Part D. Now, compare the differences of the plans in your area and take into account the formularities, the premiums, your deductibles, your co-payments, all those different details. And you can enroll in Part D plan during your initial enrollment period or on an annual enrollment period as well. Step number 7, explore private insurance options. Now, there are many private insurance options, especially when it comes to Medicare Advantage. So you want to review those plans and which one's going to be right for you. Now, there's many factors here, and I keep coming back to them, like the premiums, your networking, the additional benefits that you receive there, and all the cost-sharing structures that are available. And choosing the Advantage plan that aligns with your healthcare needs is going to be pretty ideal for what you need to have happen and budget for in retirement. Step number 8, assess the needs for long-term care insurance. Long-term care can be costly, and Medicare provides very limited coverage. So determine if long-term care insurance is going to be appropriate for you with respect to your retirement plans. Now, there's going to be a lot of research to be done here, and again, this is where you're not alone. You can consider a lot of the factors that your needs are going to be, and I would definitely suggest don't try to do it all on your own. We are here to help and can provide some details on how to plan for your long-term care. Step number 9, review and update your coverage annually. Healthcare needs can change over time, so it's very important to reassess your coverage annually. Now, you can review your Medicare and private insurance plans during the annual enrollment period and make any necessary adjustments to ensure that your coverage remains suitable for your needs. Step number 10, seek assistance. The process of enrolling into Medicare and private insurance can be complex, and if you have questions or are in need of guidance, I would look for a broker. Now, this is another name for them, could be Medicare counselors. They're insurance professionals who look at the Medicare policies that you have, and you can find them from the Medicare website, and you can look at them for assistance to help make sure that you have the correct Medicare plans for your needs. Following all these steps will help ensure that you have a smooth and well-informed transition into retirement healthcare coverage. So remember, it's essential to start the process early to understand your options and make decisions based upon your healthcare needs. Because you made it this far in the video, I want to celebrate you. What I'm offering is a special one-on-one consultation where we're going to be talking about all the different details of where you're at today, where you want to go in the future, and then see if there's any gaps that exist in your overall wealth plan. Now, some of those questions are going to pertain to health insurance as well. So it's a lot to get to, and below this video, you will actually see a link to establish that one-on-one consultation, and this is a complimentary consultation just for watching this video. I look forward to seeing you in our next one-on-one meeting.